Hello, 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 my friends. Hello, hello. Hold on. We're getting two streams started right now. Let's see. Yay, it worked. Hello, 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 my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. I am the National IC Support Group leader. This is one of our regularly scheduled IC support group meetings. I'm now doing them pretty much every Sunday, usually starting around between 12:45, 1 o'clock Pacific Standard Time. Hello, Barbara. Nice to see you. Let me just get things set up just here a little bit better. The purpose of doing these meetings is to make you so strong, so knowledgeable, so incredibly informed that no one can ever mess with you again. No one should be able to tell you that IC is all in your head. I want you to know how to respond to that in an instant. No one can tell you that there's no treatments. I want you to be able to respond to that thoroughly knowledgeable of what your treatment options are. And really, at this point in time, remember, we really no longer think of IC as an incurable bladder disease. We think of it as a pelvic pain syndrome. Why? Because structures outside of the bladder are often involved, if not more frequently involved than the bladder in many, many patients. Hello, Lisa. We got two Lisas here. Hello, Lisa H. Hello, Lisa S. Hello, Kim. Nice to see you. Hello, Donna. Nice to see you. Hi, Barbara. Nice to see you. Hello, Nancy from Missouri. I hope that you guys and Deb from Ontario, Canada. You know, it is my privilege and honor to be here to help you. And oh, 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 why is it that the good stuff happens on Fridays? Because that's when I want to spend a lot of time doing stuff and I don't. Oh my God, Mother of God research studies came out. You're going to be stunned. You're going to be stunned. Donna, I love you too. You know that. And Donna, thank you so much for your help. I so much appreciate that. Very, very much. The research study of research studies has come out, which I think is going to blow your mind because a lot of our misimpressions about IC is that it could be bacterial in nature. We now have a major research study which shows that it perhaps isn't. But before we go there, I just want a few more people to come into the room. Thank you, Donna. Thank you, Donna. So let me just introduce myself for anybody who's new. My name is Jill Osborne. I am the president of Interstitial Cystitis Network, founded in 1993. It was actually formatted in 1993, started formally in 1994. It was my doctoral dissertation proposal on how to bring support to patients who were homebound. Before that, I have several degrees. I've got a degree in chemistry. I've got a degree in pharmacology, drug development. I have a master's degree in psychology. I have a presidential internship / fellowship from the White House. So I kind of know my stuff. I mean, at least I'm pretty proud of what I've been able to do. And then one day, out of the blue, bam, IC hit. I was training for a triathlon. The pool that I was swimming in made a massive mistake with their chemicals. I sustained a very severe chemical burn. And that night that day, I was a triathlete with a great career, a promising career, things happening, to literally not being able to walk. It felt like the world's worst bladder infection. I was up all night crying. I had a hunch though, because hello, chemist. When I swam that day, I knew that something was off with the pool, but a bunch of us swam. And as I've said to other people, when you're an endorphin junkie, the endorphins are the way we deal with life and we deal with stress. And swimming was important to me. And like an idiot, after I swam for a couple of minutes and I thought something was a little off, I didn't get out of the pool. Nobody got out of the pool. The next morning, I just had a hunch. I just had a little hunch and I called the swimming pool. I talked to the manager and I went, "So, is anything weird going on with the pool yesterday?" He goes, "Why?" And I went, "Well, because I swam yesterday and then he interrupted me and he goes, "You swam?" "Yeah." Wasn't the clothes sign up?" "No." And he admitted they had done their massive acid bomb like an hour before we swam. Somebody made a catastrophic mistake. And so I swam in extremely high levels of acid, and I was burned. Now, what was interesting about that, now I know that a lot of you out there, when you have symptoms of frequency, urgency, pressure, pain, you are thinking infection. I thought infection. But guess what? The bladder, like any other part of the body, can be hurt. And mine was hurt. And in fact, ironically, even though, they admitted it, I could not sue them because we did not have the research from the industry proving that pool chemicals caused the damage that it caused me. And this was what, 1993. I spent a year barely able to walk. 5 years, I could not sit in a car without crying. And there were some cars that had a little shimmy, like my mom had a Dodge Dynasty. Oh my God, torture. Just a little waving like that. Because when you sustain a chemical injury or you have chemocystitis, which is a variant of IC subtype 2 bladder while driven, you've got a significant injury. And if you bounce it up and down, hello, it hurts. It hurts me. The other mistake, oh, and by the way, so let me finish that for a moment. So anyway, the pool admitted it. I told him the symptoms. I felt like I had a really bad bladder infection. He goes, "Oh, that's weird. I have a lot of customers who complain about that." And it's like, "Oh, really? Y'all think maybe you have a problem?" But I couldn't sue. It is now 27 years later, and last year, the Center for Disease Control finally released their chemical pool injury data. And guess what? It's happened to thousands of people. And when I started the IC network, I too have worked with many, many former swimmers who maybe about 50. I mean, it's not a big thing, but for me, it was big. The same exact thing happened to them. They had a major chemical trauma. And this is not surprising given the fact we know that chemotherapy also causes chemo-induced cystitis, right? So it is important that you understand that, and the bladder only speaks one language: frequency, urgency, pressure, pain. Everything feels like infection, even if it's injury. You could have a bullet wound and it would feel like infection. You could have a stab wound and it would feel like infection. And we all, when we have these symptoms, I gotta say that at least for the first year, I had many, many urine tests. And I will also say in my first year, it was, I'm gonna say summer of 1993, I was absolutely convinced that I was dying of cancer. The pain was so bad. And I, was talking to my urologist, I was talking to my OBGYN, and I'm like, dudes, you have to admit something. There had to be something else which is triggering this pain. I think I'm dying. I think this pain is so bad. There's something seriously wrong. I need you to look. And they went, "What do you mean?" And I said, "Open me up. Do an exploratory. I want you to look. I want you to look at my pelvis and tell me what the hell is going on here." Because I'm one of those people, man, if I've been in pain for a long period of time, I want eyeballs on the organ. I want somebody to look at it. Like, what the hell is going on with my bladder? For God's sake, please tell me. Which is why I'm not against a hydrodistension. It just has to be done correctly, right? So anyway, we go into the OR in like September 20th or something like that of 1993. Wake up in the recovery room. He goes, "Jill, you don't have cancer. You have IC. You have a really, really badly damaged bladder, but you can rest assured that you are not dying of cancer." And the interesting thing is that this is a common thought that patients with severe pain have. This is a common thought that a lot of IC patients have had. Am I dying? Is this cancer? Is this something serious? And I had been dwelling on it for months. It's like they had to have missed something. They had to have missed something. They had to have missed something, to the point that they did a urine cytology test that came back negative. And I was like, "I don't believe you. I think that's cancer. I need you to look." Now, I'm not telling you to do that. I'm not telling you to do that. I'm just telling you where my brain was at the time. I needed that. I honestly was in such I don't know if the word is denial. I was in disbelief. The pain of IC is characterized by being relentless and difficult to ignore. It's organ pain. It's organ pain. The nerves in the bladder, the pain nerves in the bladder, which are the C fiber nerves, are very, very hard to turn on. They only get turned on after major, major trauma. And this is not the pain that normal people experience in their lifetimes. But for those of you who are watching, you know how agonizing this can be. It's characterized by being relentless and difficult to ignore. It pounds away at you. You cannot sleep through it. If you're in bed and you're trying to sleep and you've got bladder pain, it is hard to fall asleep. If you've got pelvic pain, it is hard to fall asleep. And so, anyway, the point that I'm trying to make here is I need you to understand that injuries cause issues too. Injuries cause symptoms too. You can have an injury to your bladder, you can have an injury to your pelvic floor. And when we look at the 5 subtypes of IC, um, 2 of them are really, well, 3 of them potentially are focused around injury. So we got IC subtype 1, Hunner's lesions. And I have interesting news about that. IC subtype 2, bladder wall driven. That means that your bladder wall is driving your symptoms. You've got pain as your bladder fills with urine that is relieved by urination. So the fuller you get, the worse you feel, right? And then when you pee, there's a sense of relief. It's like, "Oh, thank God I found a bathroom. Thank God, I feel a little bit better." The relief might only last for 5 or 10 minutes or even 3 or 4 minutes, but there's definitely a sense of relief. Bladder wall pain is characterized by being very sharp, very shrill. It feels like ground glass. It feels like razor blades. When my injury was very, very fresh, it felt like sharp fingernails dragging down my bladder wall. It's very weird that you're like, you're going, "What the hell is that?" And then you realize you're actually feeling an organ. And that's the way it manifested for me, is it felt like somebody was scraping my bladder wall. So in this subtype, we've got a couple of variants. There are a lot of different things that can make the bladder upset. Number 1, chemical injury, like what happened to me. Number 2 is going to be estrogen atrophy. If you are of a certain age and your skin is starting to get drier, I deal with this literally daily, where women were fairly contained in their 30s and 40s, and bam, in their 50s, their symptoms come back. And their symptoms are often coming back, or just their bladders being a little bit more sensitive, just because their bladder wall is being affected by aging and by menopause a little bit. We can talk about that a little bit later. Then the third variant of this subtype is really chronic infection, chronic fungal infection, chronic bacterial infection, et cetera, et cetera. IC subtype 3 is pelvic floor driven. This is the biggest subtype, in my opinion. These are the patients whose symptoms began after some sort of muscle trauma, having a baby, a car accident, a fall, a history of athletics. Hi, Loretta. um, it can be. I was working with a lovely gentleman yesterday who was an Ironman athlete. And again, I've worked with several Ironman athletes at this point in time. And think about what they do is they do extreme sports and they sit on bicycle seats for hours and hours and hours at a time. And what does that do? That pushes the bike seat directly up into muscles and directly up into vulnerable nerves. That's why we call it bike rider syndrome. Bike rider syndrome. But it can happen after a baby. I think the most interesting trend that I have seen in the last year is tailbone injuries. I don't think that we understand the scope of tailbone injuries. The American Urogynecology Society asked for volunteers to help write their new IC guidelines, but they only wanted MDs, and obviously I'm not an MD. But I did send them a Hail Mary letter, 7-page letter, asking if I could participate on the committee, even as a silent member. And I talked about these subtypes, and I talked specifically about the tailbone injuries. because so many of you have them where your tailbone, well, one lady, her tailbone was missing, it was removed. But for others, your tailbone is supposed to be slightly crooked out, but if you break it, it gets straight, it gets crooked, it's not centered, crooked. It's amazing the toll that tailbone injuries take on the pelvic floor, and the fact that it can actually trigger bladder symptoms. All right. The next subtype after that is also an injury, and that is pudendal neuralgia. That means that a nerve is compromised in some way. Usually, it's compromised by very, very tight muscles. And our therapeutic priority for these patients, I mean, you could put these patients and the pelvic floor patients on bladder wall therapies for years, and they will never get better. Because a patient with pelvic floor issues has muscles so tight it's restricting blood flow. Our therapeutic priority for the pelvic floor patient is to restore blood flow. We've got to get these muscles released. Our therapeutic priority for the nerve patient is really to figure out what the hell is compromising the nerve. Usually it's very, very tight muscles. And so, again, our therapeutic priority is going to be to try to release the nerve and restore blood flow. And then the last subtype is central sensitization. This is also one of my subtypes. It is often inherited or sometimes happens after a major traumatic injury. It's characterized by supersensitive skin. We have a lot of drug sensitivities. We don't like taking medication because we are more prone to side effects. We tend to have weird, funky food sensitivities, not related to our bladder, but our whole body. Like for me, oatmeal. Go figure. We have a wicked sense of smell. We can smell things that other people cannot smell, and smells drive us crazy. And so that really is a sign that you have a nervous system that is simply easier to turn on. And in many cases, it's hereditary, just like it is in my family. So every woman in my family, going back generations on my mother's side, we all have this. And we've all had a sensitive bladder. I unfortunately had not only had a sensitive bladder, but then I had a massively damaged bladder from a chemical accident. So here we've got these five fundamental variants of IC, right? And then inside each variant, we've got other variants. And there are some others that are involved too. So, one of the flaws that doctors and patients make, as I said earlier, is that you assume that when you have these symptoms, it's a bacterial infection. And we know from our own National Institutes of Health MAP Research Network, that's a multidisciplinary approach to the study of pelvic pain research team that has been active for about 10 years, if not longer. They are federally funded. They get a lot of money through the National Institutes of Health, and they are studying pelvic pain. And they are using really cutting edge research methods. So they use a lot of next generation urine testing that we've been talking about in these meetings to identify more than just bacteria. We want to know if there's fungus involved. We want to know if there's virus involved. We want to know all that. So they were the ones who were able to determine that many of you having flares have fungal overgrowth. We have multiple research studies now that absolutely prove beyond a shadow of a doubt that fungal infection, candida infection in the urinary tract is a reality in the IC patient community. And I argue that it makes total sense for us because if there's ever a group that's been massively overexposed to antibiotics, it's going to be the IC patient because we've all been on antibiotics for years, or we were. And many of you self-medicate with antibiotics when you have symptoms, not understanding you're creating the perfect environment for fungus to grow. And so candida in the bladder is agonizing. I've had it. I did, I'm gonna say in 1996, 1997, when Dr. Paul Fugazzotto was kind of the rage at the time. He was a older man who, I think in South Dakota, who believed that IC was the result of a chronic fastidious embedded bacterial infection. So we all sent our urine to him, and he came back and said, yeah, you've got enterococcus or micrococcus or something like that. And he recommended doing long-term antibiotics. Didn't help my IC at all. It did give me for 2 years a drug-resistant candida infection that brought me to my knees. Candida in the bladder is agonizing. And so that is very, very important that you understand that there are other pathogens potentially at play in your symptoms, especially if you have used a lot of antibiotics. So then about 5 years ago, researchers in Europe started finding viruses in the urine of patients with Hunner's lesions. They took the urine of patients with Hunner's lesions, the worst form of IC, versus the patients without Hunner's lesions. And they only found virus in the Hunner's lesion patients. And it was one was called the first virus they talked about was the Polyoma Bk virus. The Polyoma Bk virus is a virus we all have. It's part of the human biome. It's not sexually transmitted. You can't make any statements about that. But in some patients, especially patients who are immune compromised, the Polyoma Bk virus gets turned on and it infects the bladder wall and it causes hemorrhagic cystitis, profuse bleeding. That's well documented. We know that. We know Polyoma Bk causes hemorrhagic cystitis. So this study in Europe was saying, you know what? We're finding Polyoma Bk in the urine of patients with Hunner's lesions. That needs to be explored a little bit more. And then a year or two later, they found Epstein-Barr. Isn't that interesting? And then there was and I don't remember the exact research study, but there was some discussion about HPV and herpes at some point in time. So, the thing about the American research community that you've got to understand is that they tend to be a little bit more conservative. You're not going to see them jump on stuff very quickly. They're going to be very thoughtful, very thorough. And they do a lot of stuff behind the scenes. They don't necessarily tell us about it, but like the MAP Research Network team is phenomenal. They are absolutely phenomenal. But, I've been sitting here going, come on, guys. Are you going to look at viruses? I mean, if we've got multiple studies in Europe showing viruses, come on, America. Can you look at viruses for us? They did. And here it is, my friend. Analysis of viruses present in the urine from patients with IC. And it came out, when did it come out? Last month, May 15th. And it's almost mind-blowing when you read something like this, and then you think about all of the incorrect assumptions that have been made for decades about patients with urinary tract symptoms, with the assumption that people have bacterial infection, when in fact now we have our first formal MAP Research Network, National Institutes of Health funded paper showing, guess what? They found 2 polyoma viruses. They didn't find the Epstein-Barr, but they found 2 polyoma viruses. And what was interesting about this study, and I really meant to reread it before this meeting, I just didn't have time because I had to help my mom take a shower. They followed a group of patients over time who were already participating. So let's see, a total of 50 de-identified samples were taken from 10 selected participants, five women and 5 men. And then they did it at baseline, at 6 months, at 12 months. And more importantly, they made sure that at least 3 of the samples corresponded with flares. They wanted the virus of people having flares. And there you go. So let's see. And it's a very scientific paper. And again, next generation urine testing, which is what I've been talking about for a couple of years now. So the polyoma JC virus was detected in all urine pulls. And the polyoma JC is probably not pathogenic. However, they found, again, the polyoma Bk virus, and that the polyoma Bk virus, what was that? Okay, something just flew by my head. Okay, that was weird. They found the polyoma Bk virus. In fact, they first thought it was a virus from a chimpanzee, and then they realized, no, it wasn't. They also detected several other human RNA viruses, such as H1V1 in a couple of patients, and viruses in one patient. The other thing is, when you look at DNA, you realize that viruses shed different DNA at different times. And so they were specifically looking for DNA that would correspond to a virus multiplying and replicating. And so, anyway, hold on. I'm going to do an article on this on our website. I mean, like, this is literally breaking news, like breaking news. So the polyoma Bk virus was detected in 70% of participants, but not in all of their urine samples. The JC was detected in just 30% of participants, but prevalence, let's see, okay. One patient had polyoma JC in all of her specimens. One had in 4 of 5, and one showed in 3 out of 5. Across all 50 samples, mean pain severity scores were 19.9 and 4.2. Okay. Patients with the polyoma JC had more intense pain than the patients than other patients. However, and polyoma JC was detected in 25% of flare samples. So some patients were flaring and producing virus. These patients were from the University of Michigan, University of Iowa, University of Washington, Washington University in St. Louis, and UCLA and Northwestern, just so you know. The presence of late transcripts in urine indicates that the viral life cycle was being completed in infected cells, strongly suggesting that productively infected cells were present in these samples. Our ability to detect both BK and JC indicate that both viruses are present in infected urinary tract cells. However, the RNA sequencing results support JC replication was occurring. JC replication was okay. Anyway, let's see. We cannot explain what appears to be a difference between our results and those of a pilot study. So what they're saying, what the MAP research study is saying, is that they believe that there are, and I might have been wrong when I talked about JC being non-pathogenic. I was wrong with that, so bear with me here for a moment. What they say here is that they don't understand why the other researchers didn't find the JC virus, the polyoma JC virus. Anyway. They conclude by saying that our analysis indicates a possible role in BK and symptom fluctuations in IC, with worse symptoms observed when BK is detectable in urine. A larger study is needed to confirm our findings. And one of the things that they talk about is how, yes, there were other studies 10 years ago, 15 years ago, 20 years ago looking for virus, but they didn't have the right technology. So their data potentially was flawed. Whereas now that we have next generation urine testing, and it's so good at detecting, many different things in the urine, now they're finding virus in some IC patients. And so this opens up a whole new possible treatment pathway. Antiviral medication, potentially. Now, this is really, really early. I can tell you that the next generation urine testing companies do test for viruses in urine. It's more expensive than a typical next gen that just looks for bacteria and fungus. And we certainly don't have any conclusions yet about what the right therapy is because we don't even know how many patients could have viruses. Although it appears to be, at least we would have to look at the data from Europe saying that it appears to be more common in patients with Hunner's lesions. So, again, for those of you self medicating with antibiotics, and for those of you who are absolutely sure that you have a bacterial infection, you need to take a step back and think about fungal infection and viral infection because those are real. Now, what are the odds that your local doctor is going to know any of this? Zip. Zip. That is why we'll do an article on it, and I'll have a link to this study. And if you want, you'll be able to get this study and you can print it out and give to your doctor to try to justify, hey, doc, I'd like to know. I'd like to know if I have a virus because multiple studies are finding viruses in some patients. Now, of course, this wasn't me. Remember, my IC started after a chemical burn. This is not the patient whose IC began after having a child or breaking their tailbone or somebody who has a history of athletics or somebody who was perhaps a victim of abuse in some way. You know, there are lots of different types of injuries that can happen, as well as potential pathogens that can happen, right? So, I'm really excited about this. I'm really excited about this because with this data, we can just shove it in the faces of medical care providers, and obviously in a professional way, who just keep saying this is all in your head because it's not. It's not. And some of you could legitimately have a viral infection. So if you can just hold tight and let me do some interviewing. I want to do some interviewing. I need to get some quotes from some of our top IC researchers. And I'm even going to contact the researchers in this study. And then I'm going to try to do a really comprehensive article on this to educate you more about this so that you can educate your doctors. Because you and I, guess what? We're the educators here. We are the ambassadors for the IC community. You know, whenever you go to the doctor, you have an opportunity. You're going to either make it better for the patients coming after you or worse. If you're rude, disruptive, mean, then you're going to make that environment, you're going to make those doctors not want to work with IC patients. But if you come in with an open heart, with good information, and say, I am here to solve the mystery of my pain, and you give them supporting data that helps them in your clinic, you have created an ally for life. An ally for life. All right. So that is the first fascinating news. And let me just go here. Hello, Lauren from the United Kingdom. Hello, Corrine from Belgium. Hello, David from New Jersey. Hi, Nancy. Hi, Angie from Bluegrass, Iowa. Angela says, I have a dear friend that appears to be in the process of being diagnosed. It's been many years since my diagnosis. What is the current diagnostic criteria? Angela, you can go right to our website, icnetwork.org, and read that in depth. An IC diagnosis is a diagnosis of exclusion. That patient is an anatomical mystery to be solved. And the problem is depending on what type of doctor you go to, that doctor may not look outside of their specialty. They don't like to look outside of their box. So if your friend goes to their gynecologist, the odds are the gynecologist is going to focus a little bit more on the reproductive tract. And that is one reason why some IC patients have had completely inappropriate hysterectomies that made no difference. You go to a urologist is going to look at your urinary tract, but they might miss fibroid tumors, or they might miss other things, or they might miss the pelvic floor. There are very few doctors who are experts at evaluating the entire pelvis, and that is in fact what most IC patients need. So when you go to the doctor, and you know what? Hold on a sec. My chair is just being all weird right now. Okay. Oh, I was gardening yesterday. My back hurt. Okay. So when you go to the doctor, they're going to do a history. They're going to ask for your symptoms. They might order some basic tests, like a simple urine test, as well as testing for sexually transmitted diseases, because hello, that happens too. And even if you're a virgin or you hadn't had sex for 20 years, guess what? They're still going to test you for STIs. Don't be offended. It's a proper part of the workup. They should be evaluating your pelvic floor. In fact, the most important part of that first visit is, in my opinion, the pelvic floor examination, because that will then help us understand if muscles are involved. They will then start to rule out other things like bladder cancer if that patient was a smoker. And we have a whole list of confusable conditions over on the IC Network website. One of the ones that we most recently covered is something called pelvic congestion syndrome. Also, in men, it's known as varicocele. Pelvic congestion syndrome is the equivalent of varicose veins in your pelvis. The problem with varicose veins is it messes with blood flow. And so, normally, a bladder it will be infused with about 24 units of blood. But one study found that patients with pelvic congestion syndrome only receive 9 units of blood. Really hard for a bladder to be healthy if it is deprived of good blood flow, right? Right. And so we want, and again, the cool thing here is that pelvic congestion syndrome is really quite treatable. It's a very, very treatable. But the part of it that, I mean, it just goes to show that you have to have a sense of humility when you're working with IC and when you're trying to study this, because I have in the past worked with patients who said it got much worse during the day. And by the end of the day, it was like you're carrying a bowling ball around in your pelvis. And we would have normally associated that with muscle issues, right? Muscle blood flow. I mean, it's kind of the same. It's still dealing with blood flow issues. However, that is the classic symptom of somebody with pelvic floor congestion syndrome. And so what they do is they can put a little stents in veins that are not flowing properly, and they can also reduce veins that are enlarged. And so we want to make sure during that diagnostic workup that all the easy things are ruled out first. And in fact, I always say, listen, when you walk into a doctor's office, please do not announce that you have IC. Do not do that. You will fall down the IC rabbit hole. It is far more important for you to walk in fully prepared to discuss your symptoms. And I mean, I was working with somebody else last week who just literally just couldn't verbalize it. Couldn't verbalize it at all. It's like, "Where's your pain?" "Down there." "No, no, I know it's down there." "Where is it?" "Down there." "No, no, that's not good enough." "Is it inside of your body or outside of your body?" It's like, "Oh, yeah, it's outside of my body." It's like, "Okay, well, then it's not your bladder." It's not your bladder if you feel it outside of your body. And that's a classic discussion I have with a lot of genitourinary syndrome of menopause patients, estrogen atrophy patients is, yes, you've got frequency urgency. Yes, you've got a bit of urethral sensitivity, but the classic symptom is burning on your vulva as you're peeing because the urine feels very hot. Your urine is not hot. It is not burning. It is telling you that your skin is dry. And the proper therapy for that is going to be some sort of topical estrogen product to give that skin the estrogen it needs to produce mucus and produce moisture. And so, Angela, they got to rule stuff out like that, especially the estrogen atrophy if she's older. Because again, with the estrogen atrophy patient, man, you can give them IC therapies for years, and really, honestly, it's not going to fix the problem. It might cover up part of the problem, but what has the potential of really improving the problem is giving that tissue a little bit of estrogen so that it can produce its own natural mucus, as compared to putting a chemical coating on the bladder, which comes with side effects. Elmeron is a chemical coating. Elmeron is now linked to eye disease pretty badly. Hello, Roxanne from Colorado. Lisa says, yes, this woman knows her stuff. Thank you. It is my job. Angela says 1993 was when mine started. Yep. Ginger says, Ginger is here. She has radiation cystitis that urologists hardly recognize. I know they do this because I've had 3 urologists perform the procedure on me under anesthesia to check my bladder and to take pictures of the lining of my bladder so that they could figure out treatment, which they never did. I go to a pain clinic. I take an opiate for burning pain. I've not been shopping in your store yet for what you have recommended to me on one of your programs. Okay. So again, when you have radiation, so people have radiation if they're being treated for cancer, and radiation damages tissue. So radiation is, Ginger, there you go. That is the ultimate injury. You have a radiation injury to your urinary tract. And so the question now is, what did it damage? Radiation consistently damages blood vessels. And so, you are in your own unique group. If you're diet sensitive, then doing something that would provide a protective coating on your bladder kind of makes sense. I really need to do an update on what are the current treatment protocols for radiation cystitis. I don't know if a rescue installation, if a heparin lidocaine installation would reduce your pain. Did you ever do a heparin lidocaine installation? I would think at a minimum, it would be very, very interesting to try something with palmitoethanolamide to at least try to reduce some of that pain, because PEA, palmitoethanolamide, is associated with reducing nerve pain. And so we do have Piora that you could potentially try, but we got to dive into the research. If you want to call me this week, let's work together. Maybe I can reach out to a couple of the top doctors and let's see if we can do an article on it and get an updated treatment protocol for radiation cystitis. Okay. Hello, Denise. Hi, Cheryl. How long does it take for chlorine to show a flare after swimming? Is it right away or does it take a bit like food? I probably swam around noon and I didn't have symptoms until I went to bed. I did not feel it at all. Deborah says she used to describe it as that a cat was scratching her bladder. Yep. Hi, Becky. Becky is sending love to everyone. Right back at you, Becky, if she's still here, because I'm now 24 minutes behind on my Facebook comments here. Shannon says, I am so happy. I have been pain-free for a month. Woohoo! Yeah, baby, we love this. She says it was due to Botox. So how does Botox work? Botox silences nerves. It's a step 4 treatment option that works for some patients, but it does come with some risk. But Shannon, I'm so glad it's working for you. Hi, Sarah. Lisa says, how do you get rid of Candida in the bladder? It would be with an antifungal, something like diflucan, other medications like that, as well as making sure you're not feeding the yeast with carbs and with sugar. That was the one thing with my Candida glabrata infection. Every single time I ate ice cream or drank milk or had anything with milk sugar in it, it flared like a beast. A beast. I didn't have ice cream or frozen yogurt for probably a decade because of that. Patty says she has a history of Epstein-Barr. Hello, Julia from New York. Mary says, I want to print this information and take it to my urogynecologist. How can I get it? Mary, you'll have to wait a week and let me do an article on it, okay? I mean, it's literally that news. I haven't even written an article on it. Peggy says, I am without my aloe vera. How can I get some from you? Just go to our store, IC Network, and just click on shop. And we do have Desert Harvest Aloe. We are discontinuing Desert Harvest Aloe in favor of a new aloe product that we hope to have within a month or so. So you get it while you can, because I don't believe that we will be ordering any more Desert Harvest Aloe. Liz, I had inflammation removed from the trigone area and haven't had IC pain since. I was on disability for 8 years. From the pain, it was horrible, and you had a hydro every 3 months to control the pain. So for people who don't know, the trigone is an area of your bladder that's kind of the shape of a triangle, that goes from ureter down to your urethra, kind of in that area. and it is known for being very bumpy. It's a different type of tissue. And a lot of doctors thought that bumpiness was dysfunctional, and so patients were diagnosed with trigonitis. And then what they did is they would laser off or cauterize off the trigone to get rid of this cobblestone-like appearance. That has been kind of debunked. But there's no doubt you can have inflammation in your trigone. It could have been for any number of reasons. And so, Liz, the fact that you feel better is totally awesome. Congratulations, hon. I hope, and hopefully you're not on disability anymore. I would be fascinated to find out what the biopsy results. Did they biopsy that area and what they find? Nan says, "What chemical burn am I referring to?" I had a chlorine burn. Sarah says, "Could it be a virus that goes away and comes back?" Exactly. Yes. That's what a viral infections do. Viral infections are just like herpes. It comes and goes, comes and goes. So I want to take a moment. I want to thank the sponsor for our support group meetings, which I always have to do. But I get so involved in talking to you. I get excited. I want to take a moment and thank DSC Healthcare Solutions, makers of Preleaf. Preleaf is the oldest supplement that's been used by IC patients for 30 plus years. It is made of calcium glycerophosphate, and what it does is it acts to reduce acid in your urine. So if you've got a bladder wall injury, acid hurts. Just like if you have a cut on your hand and you pour acid in it, it's going to hurt. Same is true for the bladder if you have a bladder wall injury or Hunter's lesion. So if you are in a situation where you don't have access to lower acid food, or you go to grandma's house and you're required to eat her famous lasagna without offending her terribly, you can take a couple of Preleaf before that meal and reduce the acid of that tomato. And so just know that Preleaf has been out, is considered one of the most safe supplements. It is calcium glycerophosphate is specifically mentioned in the American Urology Association guidelines as a supplement option for IC. Of course, they don't mention brand names, but they mention calcium glycerophosphate, and the only producer at that time was Preleaf. And so this is very, very viable. Some of you, though, do tend to take this like candy, and you cannot do that because it is calcium. And if you take too much calcium, you could end up with excess calcium in your bloodstream and kidney stones. And the last thing you need is kidney stones on top of IC, correct? And I also want to say that if you find these meetings helpful, please consider becoming a member of the IC network, because that's what helps pay for this too. That pays my salary so that I can do this work on your behalf and I can represent you to the top tier IC researchers. So you can become a member for $25 a year or $50 a year, or it's your choice. Lots of different things happen. But in that note, we have an unveiling. Guess what I have? Yeah, baby. Oh, look at that. I was missing that post-it. The latest IC Optimist came from the printer on Thursday. So this is our spring 2020 IC Optimist. And the lead story is 4 new lawsuits filed over the Elmeron eye disease, along with an extensive Q&A from the attorney of record about the lawsuits, and to teach you what those lawsuits are, and to help you understand, what the pros and cons are, and if you might want to become involved in a lawsuit against Johnson & Johnson because you have suffered eye damage while taking Elmeron. Okay, so that's the lead story. Second story is, in fact, our lead story on pelvic congestion syndrome. Thank you, Stacy Shannon, our top writer for the IC Network. She and I write most of the stuff for the IC Network. And so she contributed this article. Obviously, with COVID, anything that we can do to boost our immune system is important. Our challenge here is that we don't do well with typical vitamin C, and vitamin C is important for immune function. So I've contributed an article on how you can boost your vitamin C levels with non-acid fresh fruits and vegetables. We have a pelvic floor relaxation series. Things that you can do, because hello, it's been pretty damn stressful the last 2 to 3 months. In fact, I am having levator spasms. I woke up with levator spasms this morning. Levator muscle spasms for me, it feels like there's a hand up my vagina that's pulling downward, and I am having them right now. As a matter of fact, I know what to do about them, which I will be doing later today. Let's see. I talk a little bit about, let's see, what else is in this? How COVID has affected urology clinics. It's important that you understand that now that in some areas, urologists are starting to see IC patients again. In other areas, you're not. You have to understand that their priority list is really is unfortunately unfavorable to the chronic patient. They're going to take the life-threatening patient first, somebody with a total urinary retention. Then they're going to go for cancers, conditions that are potentially fatal. And they have this whole ranking system of how they are going to input patients. And this is not only at urology clinics, but at dentists and all sorts of stuff like that. You do have to understand that we, the IC patient with the chronic symptoms, are not going to be critical patients. You're going to be lower on the totem pole, but for God's sake, call and raise your hand and say you need help. If you need an installation because your bladder is screaming at you and you've got an issue with your bladder wall, then you've got to do that. John says, or Loretta says, who do we see for tailbone issues? My MRI shows a severely bent tailbone. Hello, Loretta. Hello. Thank you. Exactly. You would go to a physical medicine specialist or an orthopedic surgeon at first to have the proper imaging. And then it might be physical therapy, and it might be chiropractor, or it might be surgery. I don't know. But there you go, people. There you go, right there, right here on Facebook, Loretta. Yes, severely bent tailbone. That's fascinating to me. That was a key point that I made to the American Urology, a Urogynecology Society. It was tailbone injuries. Okay. We have an article on platelet-rich plasma, which is a promising new therapy, especially for patients with Hunner's lesions. Do you need a second or third opinion? The answer is hell yeah. Listen, if you got a doctor giving you Elmeron and giving you DMSO, you need a second opinion. If you have a doctor, you go to the first appointment and they just say you've got IC and they escort you to the door and they don't even do a pelvic floor examination, you need a second opinion. If you are not responding to therapy, you need a second opinion. If you've been taking the same medications over and over and over again and you're not better, you need a second opinion or a third opinion or a fourth opinion. Keep asking until you find somebody who can do a proper pelvic floor assessment, because wouldn't it be sad to discover after the fact the reason why for a woman, the reason why you have pain is because you've got a freaking fibroid tumor pushing on your bladder. And we know that when the fibroid tumors are treated and or removed, the bladder heals and symptoms go away in the great majority of patients who had them. And the same is true for fungal infection. Wouldn't it be ironic if all this time they kept giving you antibiotics over and over and over and over again? Wicked Candida infection. You never know. That's why you got to ask. What else do I have in here? So this is a good article on, do you need a second opinion? We have the latest IC research with another bacterial study, which again does not make any significant bacterial findings in IC patients using next generation urine testing. Another Elmeron IC study, Japanese guidelines. There's an interesting one, an article, a study on frankincense and myrrh. Frankincense and myrrh as a treatment for IC from Taiwan. Fascinating. I think one of the most compelling stories. This has really changed our daily routine right now in our house is, what the hell happened to raisins? So every year, the Environmental Working Group releases something called the Clean 15 and the Dirty Dozen. And this is data from our own Department of Agriculture. And this is data on what fruits and vegetables are contaminated with pesticides and other chemicals. So the clean 15 are the cleanest fruits and vegetables. The ones you can buy, you don't have to buy organic. They're considered very, very safe. So as an example, the cleanest fruits are avocados, sweet peas, broccoli, sweet corn, eggplant, mushrooms, pineapple, asparagus, cabbage, onions, cauliflower, honeydew melon, papaya, cantaloupe, and kiwi. The dirtiest foods are strawberries, apples, pears, spinach, grapes, yada yada. But then they did a special note on raisins. 99% of conventional raisins and 91% of organic raisins heavily, heavily contaminated with pesticides. Stunning. Like, what the heck? Raisins are one of the dirtiest product commodities on the market, and even organic raisins are contaminated. As one of the most popular healthy snacks, children under the age of 15 eat a total of 208 million pounds of raisins each year. About half of the raisins consumed in the US are consumed by kids. The average consumer eats 1.25 pounds of raisins. And yet, several of the most commonly detected pesticides on raisins can harm the still developing brain and reproductive systems of infants and children. Things banned in Europe. It's stunning. Ironically, I just bought 6 loaves of raisin bread that I put in my freezer, Ezekiel bread, and they're all in the trash. I'm not going to touch a raisin. Like, literally, I'm not going to eat. I'm not letting anybody in my family eat raisins unless they come from our family grape property, because I do have, my sister grows grapes. But anyway. And here's another fascinating article. And this was something that I just didn't understand. And we have talked about this before. There are a group of patients who flare when they eat probiotics, acidophilus. And I will tell you, never made sense to me. And many of you have talked to me, and we've talked about that. I did not understand from a biological perspective why taking a probiotic would trigger a flare in a small group of patients, not everybody, but a small group of patients. Gay Sandler explained it. Gay Sandler is a longtime IC activist. She's the author of 2 books on IC. I am editing her 3rd book on IC right now, which is the first book to talk about subtypes. So I was talking to her one day and she goes, Jill, I know exactly what that is. Like, what is it? Why would patients flare taking a probiotic? She goes, it's histamine overload. What the hell's that? What is that? What is histamine overload? Well, it means that if you take too many probiotics, especially there are some probiotics, some species of probiotics that are incredibly high in histamines, that you can basically trigger a histamine reaction. And so anyway, got a really good article on that. And there you go. That's it. So, woohoo! Spring 2020, IC Optimist. If you want a copy of it, it's available right now over on the IC Network. You can get individual copies, or better yet, become a member, because for members, if you get the $25 membership, you can get the last 5 issues, as well as 4 future issues. So like 9 issues for $25. You got to admit, that's a pretty good deal. And that's our fundraiser. That's how we keep working. If you would rather have it mailed to you rather than reading it online, it's $50, but then you get 2 years worth of back issues, as well as our flare guide, as well as a lot of other stuff in your member area. And anyway, there's more. So come on over to the IC Network, icnetwork.org, go into our store or at the top of the page, and you can join. But you know what? This is free. And the reason why this support group is free is because we have members who believe in supporting us so that we can support you. All right, enough on that. There you go. There's our promo for the day. I'm drinking my pumpkin spice rooibos tea, bladder friendly. All right. Whoops. I will tell you, I had a little flare I had 2 nights ago because I am now my bladder wall is completely healthy. You look at my bladder wall, I had a hydrodistension 3 years ago, perfectly fine. There's nothing wrong with my bladder other than a little bit of estrogen atrophy. And I did make a little mistake. I had a hard cider right before I went to bed, and I didn't follow it with water, and I was up that night peeing several times. But that's not because I have a fundamental my bladder wall is not diseased. My bladder wall is not injured. My bladder wall is thinner because I am older. And I can get away with having a lot of you can get away with having a little bit of alcohol. But normally you don't do it right before you go to bed. You do it at dinner time and you chase it with water, which I did not do. I was a fool. But I'm better now. It was very short. All right, let's keep going to your questions. Samantha says, my functional medicine doctor sent me an article and she mentioned I could have a virus. I have IC and I had Epstein-Barr and shingles in the last 10 years. Absolutely, Samantha. Nan says, what's the kind of doctor that evaluates the entire pelvic floor? Not a doctor at all. It's going to be a pelvic floor physical therapist. Your doctor is just going to do the superficial 30-second exam. They just stick their finger in, touch muscles. If you're tight, they pull it out. They send you to a pelvic floor specialist. And that's always going to be a physical therapist. And it's a physical therapist that's going to do a comprehensive evaluation of the pelvic floor. Some of you are talking about ozone blood treatments, where they take your blood, oxygenate it, and then give it back to you. It's bright red because of all the oxygen. I don't really have any data off the top of my head about the effectiveness of ozone. How much does it cost? I mean, we know that hyperbaric oxygen therapy can be very helpful. Why? Because it's pushing oxygen to the bladder to enhance healing. And so I can see why oxygenation would be helpful for those patients who have a bladder wall injury for sure, or any type of injury. Jamie says Peoria is great, but you still need the bladder builder. Yeah, if you've got a bladder wall, if your bladder wall is part of the problem, doing something with chondroitin is helpful because it creates a bit of a coating. Lauren says, I'm not sure which subgroup I am, but I have agonizing pain inside like a potato peeler going around and around. I'm good. I'm sensitive and I have infections, but mostly show infections. Lauren, where? Can you tell me where? You say you have agonizing pain inside like a potato peeler. Where? Guys, we're going to be switching over to a Zoom meeting probably in a half an hour. And you'll be able to tell your stories by yourself, so that you'll actually be able to. Hello, Marianne from Denmark. Do you know if do I know about low dose naltrexone? Yes, and you're saying it helped you a lot. Awesome. Again, it's one option. Heather says, can you touch the APF in the urine of IC patients? Is there any movement as far as meds to help remove that from urine? No. APF is the anti-proliferative factor that was discovered by Dr. Susan Kie at the University of Maryland 20 years ago. They believed, so that was one of the first, I can't say biome studies, but Susan Kie is a very top ICU researcher at the time at the University of Maryland. And they were doing extensive testing to try to determine if there was a bacteria. Now, remember, this is before next generation urine testing. So in the tests they were doing back then, they could not find any bacteria or anything unusual. But what they did find is something called APF, the anti-proliferative factor. The anti-proliferative factor, the little tiny protein made by the bladder that appeared to interfere with healing of the bladder. That research has fallen flat. Nothing. I'm not aware of anything that's been done on it in a decade. I could be wrong. I can tell you that there have been multiple attempts to try to create a urine test for anti-proliferative factor to diagnose IC. All of those studies failed. We reviewed a couple of those when I sat on the US Army IC Research Board, and they just didn't go anywhere. So I just don't have anything new on APF. at least off the top of my head. Veronica says, "What's a new research breakthrough? It is the identification of the polyoma BK virus in the urine of some IC patients by our own National Institutes of Health, which is now helping us understand why some patients have chronic symptoms, that it could actually be a viral infection in some of you." Jessica says, "Are you able to ship to Canada?" Hell yeah. Yeah, every day. You know what? I'm swearing today. I apologize. I am swearing today. I just guys, it's the you're seeing the real Jill Osborne right now. Between the fires, we had 2 yesterday, and coronavirus, and caring for elderly patients, along with all the tragic things that have happened recently in our country. Yeah, yeah, yeah. I'm swearing out of frustration and anger and all that sort of stuff. You know what? And just bear with me. I wanna stop and make a point here. I wrote an article that I put on our in our blog a couple of days ago about Black Lives Matter. Black Lives Matter. Black health matters. And my career has been for the last 30 years trying to help IC patients, or the last 27 years, trying to help every IC patient I could. And it is an undeniable fact that medical care is harder for Black Americans. It is when we think I mean, God, there's so much going through my head, and there's so many patient stories I can share, and I just don't wanna overwhelm you. But what I wanna say is that every single one of you deserves the best that I can give you. Every single one of you. And I was thinking about that this morning, and you know what? I'm from California. I'm from Northern California. I don't live I mean, I can't say this right, and I wanna say this the right way. And Donna, you know my heart, and you tell me if I screw up. Please tell me if I screw up in any way, shape, or form. If there's anything that I can do to help you, please ask. If you are suffering any abuse that I can help you with a doctor, with a medical care system, with a nursing home, anything, please ask. I stand with you. I will fight for you, and I will be your partner in any way that I can be. And when I look at the research studies, African Americans, the African community in general, Black community in general, completely underrepresented. Completely. We have never had a Black support group leader. We need more. And I want to make it happen because you are underrepresented and you deserve to be represented. And I want to make sure you are represented. And I would rather have you sitting right here with me so we can do this together because I'm pissed off. We all should be pissed off. Okay, that's all I'm going to say. You can go read my blog. Hey, man, if you don't like what I'm saying here, you don't agree with me, unfriend me. It's okay. You don't have to follow me. But I'm here for everybody. For everybody. Okay. Whew. It's one of those times where, you have so many emotions going through your head, you almost can't even talk about it clearly. And so just please, please go read what I wrote. Okay. Casey says, with this pandemic, everything is changing. My doctor has stopped seeing IC patients. Every office near me in Washington has deprioritized IC patients. Why won't doctors see IC patients? Because it's not life threatening, and they don't necessarily understand that you feel like your life is threatened. Because you are not a cancer patient. You are not dying you might feel like it, but you're not. IC is not life-threatening. Hunter's lesions are not life-threatening. Bladder wall injury is not life-threatening. Pelvic floor injury is not life-threatening. So you're going to be lower on the totem pole. Denise says, what are nitrates in urine and leukocytes in urine? So leukocytes in urine are common in IC patients because whenever you have an injury, your body is going to send leukocytes to that area of that injury to try to kill whatever it is. Even if you have estrogen atrophy and urine's getting through to the bladder wall, urine doesn't belong in the bladder wall. Your body's going to send your army to fight it, and that's leukocytes. So many IC patients have leukocytes in their urine, but nitrites are produced by bacteria. The human body does not produce nitrates. And so if you have positive nitrites, you definitely have a bacterial infection. If you have positive leukocytes, but not positive nitrites, you probably do not have a bacterial infection. You're probably having a flare. My dad, who's 97, constantly has leukocytes in his urine. He's got, he's dealing with a urinary tract that's 97 years old. Stephanie said, I recently had a hysterectomy, now recovering, but IC is giving me so much pain. Is this common after surgery? Stephanie, it is common, but I have to wonder, at least I had my hysterectomy 3 years ago, and I had a hell of a lot of pain for 10 months after my hysterectomy, but it was pelvic floor spasms. Mary Jane says, does the ICN have, and you didn't finish that question. Sharon says, I've suffered with IC for 34 years, changing symptoms throughout the years. I find my IC pain is a feeling of incomplete emptying of the bladder or feeling like you have a full bladder. This comes with period and low back pain. Recently, in the last few months, I have had hot flashes every 30 minutes and have not had any symptoms until 3 weeks ago. Hot flashes stopped and my IC returned. Had a pelvic floor exam, was told all the muscles were fine. I'm also on estrogen cream, which have helped for a few months. Could it just be hormones? The answer is yes. It could be hormones. There has always been a small subgroup of IC patients who have really weird hormone abnormalities. And once the hormone abnormalities are corrected, then their symptoms tend to go away. Mary Jane says, are organic raisins okay? No, they're not. 91% of organic raisins tested had pesticides. Cheryl says she wants to try Peora. Awesome. You can find it in our shop on our store. Cheryl says, why am I up every hour at night to pee, sometimes every 20 minutes for the first few hours? Well, let me describe a flare. A bladder wall flare. So remember, we have different types of flares. So let's talk about a bladder wall flare. You go to bed at 11. Of course, you peed before you've gone to bed. You wake up at 12:30. Your bladder feels very full. You go to the bathroom. You pee out a quarter cup of urine. You go back to bed. You wake up 30 minutes later. Your bladder feels very, very full. You go to the bathroom. You pee out maybe a teaspoon. You go back to bed. If you're lucky enough to fall asleep, you might fall asleep for 15, 20 minutes. Then you feel frequency urgency pain again. You get up, you go to the bathroom, you push and push and push, and you get a drop. And then you're stuck in the hell of feeling like your bladder's full even when it's empty. And that is a typical bladder wall flare, feeling full even if you're empty. That is the way your bladder wall tells you it is extremely irritated. It is extremely irritated. And so, number one, we want to try to figure out what triggered it in the first place. Usually it's some sort of food for that type of flare. The second thing, so we'll use what I did the other night, which is why I had a hard cider before I went to bed. Again, utter stupidity on my part. So normally the first thing you would do is you would dilute your urine with water. So drink a glass of water to try to dilute any of the irritants that might be in your urine. You could even drink 2 glasses. Don't chug 2 glasses because you're going to give yourself a mini hydrodistension. Your bladder wall's already really tender. An IC patient by how we drink water because we sip water over a period of an hour rather than chugging water. So when you're having a flare from food, from an acid food or from caffeine or whatever, sip a glass of water over a period of an hour. Let's just try to get your urine a little bit more diluted. You could alkalinize your urine with pre-leaf or with Tums. Or you could do like a quarter teaspoon of baking soda in a big glass of water. Do not do a lot. More is not better. For God's sake, don't do a teaspoon. Even half a teaspoon could be a lot. Sodium bicarbonate is sodium. It can raise your blood pressure. That is why it is not recommended by most doctors. They would prefer that you do a calcium-based product like Pre-Leaf. But if you don't have something like that, many doctors over the years, so I've got the oldest books out there on IC, all say a little bit of baking soda in a glass of water would be worth a try because that will alkalinize your urine. Then what you could do is you could do something that will numb your bladder wall like azo or pyridium. You know, the pill you take that turns your urine dark orange, azo. That will work for minor irritation, but it's not really going to cut into big time pain. For me, I had those flares for 5 years. I don't have those. I mean, that was the first diet-induced flare I probably had in 2 years that I had yesterday or the day before yesterday. Um, you know, you're inevitably gonna ride it out. You're just gonna ride it out. It means you get up out of bed, you go get your heating pad, you get a hot cup of something, you go sit in your family room, put your feet up, put your heating pad on your belly, and just try to get through the next couple of hours, knowing that as your urine gets diluted, things should slowly improve. That is a typical bladder wall flare for people with bladder wall injury. I hope that helped. Now, in contrast, if you had a flare after sex, if you had a flare after a long car ride, if you had a flare after falling or a long plane flight, that is a muscle flare. That is not yes, you have frequency, urgency, pressure, pain, but you have a muscle issue going on. So our priority for that's different. Our priority for that is going to be to calm and soothe muscle. So that's when number one, you go get a heating pad and you slap it on your belly. Then you put your feet up, rest, give your muscles an opportunity to relax. You could do, and maybe after a half an hour or so, you could you could try some of the pelvic floor stretches, right? The prayer pose, as an example, is something that puts your pelvic floor muscles exactly where they need to be. And so, if you're out at the bank and you're standing in line with your face mask on, obviously drop your keys and then just squat down for a couple of seconds like this. And just know that this will help your pelvic floor get into its normal, correct positioning. You could do a muscle relaxant like baclofen or Flexeril. Here's some more pelvic floor stretches right here, right? This is one of my favorites right here. These all feel good. You could do a muscle relaxant, Valium, Flexeril, Baclofen. Baclofen is the non-sedating muscle relaxant. So baclofen is the muscle relaxant that's usually recommended first. I can't take baclofen. It makes my chin itch. I don't know why. It's weird. So when I'm having pelvic floor spasms, I will do a quarter of a Flexeril, the lowest dose of the Flexeril. You can also, your doctor also can give you some vaginal Valium suppositories or rectal suppositories for men that will give the muscle relaxant right in the location they need it, which is internally. You could do some CBD. If you have CBD creams, you can rub that on your lower abdomen. That might help reduce some of that muscle pain too. But these are different types of flares, my friends, different types of flares. And you can have there are other types of flares. You can have a stress flare. You can have a Candida flare, right? Ralph says, membership is a great deal for me. Awesome. Jessica, I used to work for a naturopath. She told me years ago that some of her patients flare with probiotics with their IC symptoms too, or with their intestinal symptoms too. She always used to warn them to watch how they do it and then let her know so she could adjust the dose. And Jessica, actually, they actually identified the species, the histamine, the high histamine species that patients should avoid. Patients who struggle with flares when they take probiotics. Um, this is such a good article. I'm so glad Gay wrote it for us. Let's see. So you're supposed to avoid probiotics containing Lactobacillus casei, which is CASEI, and Lactobacillus bulgaricus, both of which are very high in histamine. There are some others too that are not quite as high, but anyway, we go through that in this article. You know, I started eating coconut. I'm eating dried coconut. I really like it. Christine says, so is there any research on what should be done if a virus like Epstein-Barr caused IC? If it's not published yet, hun. I'm sure it's happening. I'm sure it's happening in Europe. I'm sure it's probably starting to happen in the United States. But you know, I last year or 2 years ago, I reached out to one of my counterparts in Europe and I said, "What do you do when you find a viral infection? How do you treat it?" And she said, "Well, we don't really know. We look for the virus, but we don't know how to treat it. I mean, at least not in a formalized, standardized way. Obviously, it would probably be an antiviral medicine." You know, for anybody who's had Bell's palsy, you know, where your face falls because on one side because of a virus, they normally put you immediately on an antiviral medication, which then fixes that in a week or so. Patty says, I got hold of my urologist recently. Told them I want a pelvic floor assessment. Yeah, baby. I love your assertiveness. You go, girl. I also plan on asking to be tested for Candida and your estrogen levels. Awesome. But just know that the blood estrogen levels are, you know, I'm not going to say they're unnecessary because I like data and that's good data, but uh there's no substitute for eyeballs on your vulva and your vagina. You can see estrogen atrophy. It's very visible. And so you really want them to look down there and really look for dryness. And there apparently horizontal lines occur. I will tell you also now, guys, I mean, you know, I have no shame. I'll talk about anything pretty much. After my hysterectomy, which was a total hysterectomy, um, my inner labia disappeared, just gone. That happens with a loss of estrogen sometimes. You didn't need to know that, but you know, no shame. Trudy says, fractured my tailbone in 3 places, fell down the stairs by tripping over your dog. Classic. Classic. Jessica, I'm curious. My urine seems to be very alkaline. Whenever I use a test strip, it's 8 or 8.5. I only drink spring water for about a year now. Your previous advice. Can a person have problems with pain in their bladder because the urine is too alkaline? Yes. Years ago, it was too acidic and I would get pain in my urethra. Then in 2007, I started a very healthy diet. And since then, your urine is alkaline. And now I have pain in the actual bladder. I'm not sure if this is a coincidence. I was hoping to try to get a more neutral pH, but it is a waste of time for me to test pH. But is it a waste of time for me to test the pH of my urine? You know, Jessica, you have to understand that pH in your bloodstream pH in your bloodstream is meticulously controlled by your body. So this is it's not like your whole body is alkaline. It's just that your urine has become alkaline. And I would talk to your doctor about that. I mean, normal urine pH, it usually starts, oh, I don't even remember, like either a high 5 or a low 6, and then it slowly changes and becomes more neutral as the day passes. I don't know. I don't know, hun. Patty says the sound is very low. I'm sorry, guys. I'm doing my best I can with my sound. Lauren says, "Can you be a member of the IC network just because you're in the United Kingdom?" Oh, yes, you can. Absolutely. Absolutely. And you should do the $25 membership because then nothing is shipped to you and you can download everything and you don't have to pay the crazy shipping that happens with United Kingdom orders. All right. Now, Facebook only lets me do certain things. And Jessica, are your articles public for me to share on Facebook? The articles in the magazine don't normally go onto the IC Network website for 6 months, 6 to 9 months, unless it's a really urgent situation like the Elmeron eye issue. I will have the attorney interview on our website this week, probably. Um, it's but our entire website's free and public, and you can share anything there. And I have a really big blog over there, and you can share anything in the blog too. But the articles in the magazine are special for our members because we have to have a way to support our work. Cheryl says, "Well, that's part of my problem, Jill. I haven't had any health insurance for 5 years, so I've not been able to take any medications for it. But I am going to look into getting some soon. I have an appointment. I will need to get some advice." Yeah, I'll help you prepare for that first appointment if you want. That's not a problem. I know friends shouldn't share their meds, but when I'm having a pelvic floor flare, I've used a friend's Flexeril and thought it worked great. Well, you're right. We can't be talking about that. We shouldn't be sharing medication. Donna, hello, Donna. Donna, I have not seen you in ages. How are you doing, girl? I haven't talked to you in a while. I mean, so Donna on Facebook has been into our support group several times. And Donna, if I remember correctly, didn't they say that for you, you had a really significant pelvic floor issue? And so what's going on with your pelvic floor? Patty says, "I have an issue where sometimes I can feel a lot of tightness and tension in my pelvis, but then other times where it's the opposite and feels like it's being stretched." Classic. Classic. Allison says, "Do high oxalate foods have anything to do with causing flares?" Yeah, they could. Oxalates are irritating. Oxalates are very, very irritating if you got sensitive skin. And so, absolutely, there are some patients who do better removing oxalates in foods. And I'll tell you, Allison, literally the very first book ever written on the IC diet, A Taste of the Good Life, which is now out of print. We can't get it anymore. Is the book that not only talked about oxalates irritating the bladder, but also every recipe in this is rated uh, with respect to oxalate levels. There are little symbols next to the recipes. Here, hold on a sec. So if you can find one of these books somewhere, anywhere. So a recipe with a check mark corresponds with both an IC diet and a low oxalate diet, like asparagus roll appetizers. So you look for the check mark. And I think, I don't remember off the top of my head if the Confident Choices diet book does that. Cheryl says she uses pelvic floor. She uses a heating pad for pelvic floor flares, and it helps. Awesome. Lisa on Facebook, I mean on YouTube says, when her hormones were fixed, her bladder calmed down. Awesome. Elise says, "My blood pressure medication makes my bladder pain so much worse. I've tried different types and they all increase the pain. but I have to take it because my blood pressure is critical high. It's hard. Yeah. It is hard. I need to, what I should do again is I should see if we can get updated commentary on how to select blood pressure medication when it triggers bladder pain. I got to write some of this stuff down. God, you guys always give me stuff to do. Hold on a sec. All right. So my homework so far is an updated article on radiation cystitis and on blood pressure meds. I'm going to turn around our summer issue real quick. I hope to have our summer issue done in the middle of July. Okay, you know what? Let's take a break. You guys, anybody who needs to use bathroom, go use bathroom, go get your drinks, whatever. I'm going to set up the Zoom meeting and let's transition over to Zoom so that y'all can talk. Now, people, I do want you to understand that when you're over in Zoom, people are going to hear you. I'm going to leave Facebook up and YouTube up for probably 30 minutes. So anything you say in the Zoom meeting is going to be heard through Facebook and or YouTube. I will eventually shut those down as we get everybody in, so that we can have a private conversation too. Okay. So give me a moment. Let me set things up. Go take your break. Get a snack. IC friendly. Make some popcorn. Go get a Gala apple. Handful of almonds. All right, hold on a sec. Oh, wrong. Hold on. I forgot. I do Zoom in another browser. Now, I also do want to say that we're going to have a guest speaker. Julie Byer's going to come in, not today because I haven't set it up for today, but we're gonna start doing some special events again. I'm going to try to do throughout the summer and especially during IC Awareness Month, try to bring in as many of the top IC experts as I can into a Zoom meeting so that you can see them and talk to them, and so that we can have, the IC network. We've already done more than 100 live. But they were chat based, they weren't video based. So now that we have Zoom, we're going to start doing that again. Julie Byers is going to be one of our first ones. And she's already said yes. We just have to set up a date. And then I have to announce it. We have a capacity of 300 people in our room right now. I can make that more. But anyway, there you go. So hold on a sec. This is the best part. Hello, John. Hey, John. How are you doing? All right. Oh, the joys of technology. All right, there we go. I get to record my screen, share my screen, which is very, very cool. Okay, so I'm going to send out the invites, and I'm also going to give you the password. So Facebook, And the password is the numbers right underneath that. YouTube. There's your invitation. Here's your password. Hold on. All right. So guys, please come on in and let's join the Zoom meeting. Uh-oh. Facebook just took a dive. Hello, Lisa. Hi, Allison. Hi, Mickey. And I need to mute you guys. Sorry. I'm going to mute you at first, and then you will be unmuted. All right. Hello, Kelsey. Hello, Linnea. Awesome sauce. And there's Brittany. Hello, Brittany. You guys, I got room for lots of people, up to 300 people. We don't have 300 people in here, obviously, but please come join. Please come join our Zoom meeting. It's super, super fun. I'm posting. Hello, Kathy. There's your password again. Facebook, on the link. YouTube. Okay, Facebook. I don't know what's happening on Facebook. You keep fading out on Facebook right now. Hello, Diane. Helen, just click on the link I'm putting in the thing. There you go. Click on that link, which is the numbers. It might have you download a little program. Facebook, I'm sorry, video is Cindy, thank you for sending stars. Guys, one of the other ways that you can support us if you're on Facebook is you can send us stars. Hello, Kathleen. Hi, Faith. How are you? Wave. We're going to do the pon. I'm a ninja fan. That's a ninja dance. Julie, in 2012, I think I heard a pop. I felt this horrendous pain go from my left buttock down the side of my leg and the back. My dear, I couldn't walk, went to emergency. They did x-rays, said I tore small tissue, sent me away with anti-inflammatory drugs. I hurt for 2 years, couldn't sleep. 2014, I went to an orthopedic doctor. He gave me a cortisone on the leg and hip for 2 years. I have a thickening of the bladder wall, Hunter's pelvic pain, perineum. Could be because there's something called a somatovisceral reflex. A somatovisceral reflex means that muscles can change organs. The thing you've got to understand about the pelvis is things operate. They don't operate in isolation. Your bladder is related to your muscles, related to your nerves, et cetera, et cetera, et cetera. And we know muscles will get tight in a guarding reflex. So that's a given. But we also know muscles can affect the bladder. That's a somatovisceral reflex. So if you have chronic muscle dysfunction, here we go. Hello, Donna. Hello, Stephanie. So if you've got chronic muscle tension, the challenge here is that it's going to restrict blood flow to the other organs, and it's going to involve nerves, and nerves are going to become compromised. Then Neuroinflammation goes from the muscles up to the spinal cord, down to the bladder, and bam, the bladder wall starts producing substance P, which then causes the bladder wall to break down. That is a very quick explanation for that. You can read all of that in this book. Where is it? Where did I put it? So, like, seriously, the book to buy for everybody with any sort of muscle issue. Julie, you get this book, you read this book, it will explain everything to you, okay? All right. So now we've got a nice group of people here on Zoom. So we're going to now remember, my friends on Zoom, you have to remember that other people have the potential of hearing what you're saying. So do not say anything too personal. And Facebook keeps going black for me. They're saying we're having trouble playing the video. So I'm just going to leave that up just a little bit. YouTube, we still have people here. It is unstable too. Great. That's because I'm streaming on 3 things. Okay. So this is what we're going to do. I am going to I have to turn off one of you. Darn. Crap. I don't know who to turn off. You know what? I'm not going to turn any. Let's just see what happens with Zoom. All right. So my friends on Zoom, hello. Wave. Everybody wave to each other. Look at these beautiful faces. Look at these beautiful faces. I love it. So you guys, it just kind of gives me people randomly. She's walking right now. Brittany. Hello, Brittany.
Hi.
How are you? How are you feeling today?
I'm actually not feeling too bad today. Today's a pretty good day.
Okay, we like that. We like that very much. So tell us about your IC. Are you having any issues with your IC?
It started about 3 months ago.
Oh.
I've had a little trouble figuring out a subtype. I've been going to my urologist. She sent me to a pelvic floor specialist or therapist who said my muscles were tight, but not. She didn't believe it was what was driving my symptoms, basically.
Okay. What you're seeing me do is what I do whenever I work with anybody on the phone, because I do. All I'm trying to do is trying to help you verbalize your symptoms and understand the things that could have been triggering those symptoms. So, how old are you?
Right, I'm 30.
Okay, and you said you all.
Yes, although I will say, 10 years ago when I was 20, I did have some IC symptoms for about 6 months after a UTI.
Okay.
It gradually got better and mostly went away.
Okay.
I don't know if this will make sense at all, but the end of my stream always felt a little bit different after that. Like a little harsher. And it didn't really bother me much.
Okay. I'm trying to understand that symptom. So what? Okay, so you had an infection. The infection was treated, but urination changed for you. Urination changed in some way.
Right.
It felt harsher. It felt different. How?
Right. But it didn't. I know. Whenever I tell people that, it's hard to explain.
Is it harder to push out? Do you feel like you're having to push to empty your urine?
No, not really.
Is your skin more sensitive on your vulva, urethra?
I did have issues with vulvodynia a couple times throughout my 20s.
Okay.
But one time it was pretty bad. I couldn't wear jeans.
Okay.
I had to wear stretchy pants, and that mostly went away, but my skin is still sensitive.
So this is connected. We used to call vulvodynia IC on the outside. And also had vulvodynia in my 20s. I also went through a phase where I could not wear jeans in my 20s. Uh,
Right.
for years, actually. It started in high school and just um, and so we used to call vulvodynia on I see on the outside, and our assumption was that it was some sort of neuroinflammation affecting not only the bladder but also the vulva. But that has changed a bit because now we are really looking at muscles compromising nerves. Book has an excellent chapter on vulvodynia and why vulvodynia happens. Okay.
Gotcha.
And so are you an athlete?
I used to ride horses
No. Oh,
competitively. So
okay. Okay. So that you're like the Ironman athlete I was working with yesterday. Okay. You took and I wrote English too. We my sister was a 3-day eventer. I was more barn.
that's what I did.
Yeah. So I was more barn crew rather than, I mean, I rode and I took lessons, but I was never going to be as good as she was. I was kind of pretty big and gangly on a horse. Plus, when I fall hard. But you sustained multiple repetitive traumas. I mean, think about how you're sitting on a horse. And darn it, I'm wearing black pants again. I have to stop wearing black pants. Oh my God, because you can't see. Dang it. Dang it. I should be wearing shorts right now. But so let's just do it from the side, right? Okay, so you're riding like this, or you're posting, right? Like this. But your legs are open. Your legs are open. The pressure of the saddle is coming right up onto your pudendal nerve. I mean, it's like
Wow.
Okay, somebody please tell me to not wear black pants because I have to be able to demo and I always forget that. Okay.
Hey Jeff, what time do you think
Oh wait, hold on.
Sorry.
Somebody else. Oh, that's okay. That's okay.
that was my mom? Sorry.
That's okay. Well, tell her hi from the IC Network. Tell her hi from Jill at the IC Network and everybody else in the room. Again, I am not somebody who should be making any sort of diagnosis, but what I am going to tell you is that you are a classic patient that we see who has sustained constant pelvic floor tension and trauma. And if I were to put a guess on it, I think that, and if you read this book and you read this section on pudendal neuralgia, and you look at the diagrams and you look and see how the saddle was pushing against those muscles, and you think and recall the many times you took a jump and your horse and your crotch hit the the center of the saddle. I think honestly that this is a direction that I would be going if I were in your shoes. Is I would be looking at muscle and looking at nerves. If you hadn't said vulvodynia and you hadn't said you were a competitive horseback rider, we have another competitive horseback rider in our group too, Sue, and her symptoms started after a very bad fall. But girl, I think you need to pursue that. What state do you live in?
Tennessee.
So we have
Nashville.
So there's a website called pelvicguru.com, pelvicguru.com. And it's a database of all the physical therapists who specialize in pelvic floor work. If I were you, that would be my next step, is let's try to get your pelvic floor evaluated much more carefully, but you have to tell them that you were a competitive horseback rider, and you have to think about any trauma you might have had, any noticeable events that you might have had,
Right. Yeah, so my symptoms more recently started after a period of a lot of stress. I was under a lot of stress with a job, like an unreal amount of stress. And I woke up overnight and I thought I had a UTI.
Yeah.
So I had this burning in my bladder and urethra, but it didn't progress like my normal UTIs do. And it almost got better, and then I went to work the next day and it got much worse.
Okay.
Like burning.
Okay. So burning is very specifically a muscle symptom. A muscle that's working hard builds up lactic acid, and that causes that burning sensation. So when you say,
Right.
so you felt better after you slept because your muscles had a chance to relax. You felt fairly good in the morning. You went to work. How long was the car ride to work?
About 30 minutes.
Okay, so you had the long car ride. You're sitting, which is sitting in a car is somewhat similar to sitting on a saddle, except nothing's pushing up between your legs unless you got a really weird car seat. But again, you've opened up your pelvis and you're vibrating on your pelvis. And then depending upon the type of work you do, what kind of work do you do?
I'm a vet tech.
Okay.
In an animal hospital.
Okay. Okay. Well, you know, I love you for doing that work that you do. It's just it's just very, very special person who can work with animals, especially injured animals. But it's hard work. It's painful work,
Right.
physically, mentally, and emotionally.
It's physical, for sure.
Yeah. Yeah. So if I were you, I would really be looking at your pelvic floor. And he talks about the nuance of nerve injury in this book. He believes that many more patients have nerve injuries than they realize, and that the signs are subtle, but vulvodynia is a sign that potentially that a nerve is involved, et cetera, et cetera. And so I think that you really need to read this book, and it's free on Kindle Unlimited. If you have Kindle Unlimited, it's free. So,
Right. I actually did download that book. So
good.
I like it a lot. So
are you reading? Have you read it?
I've read parts of it. I'm still going through it.
Okay, don't jump, but you can't jump around. Like you literally have to read the first 3 chapters first, understand the discussions in the later chapters. It's really, I jumped around too, but then you got to go back and you got to do the work and you really try to understand the muscles. And in your case, you really have to think about writing and how you were writing was impacting your muscles. And then again, it's about nuance too. Do you have pain on the left side versus the right side, front versus back, low versus high? Again, with the Ironman athlete I was working, he was really convinced it was his bladder, but then he said, but my pain is about an inch to the left. It's like, okay, well then that's not your bladder. Anytime you can point to it, I mean, the bladder centered under your belly button, but I mean, it's down below, but it's in straight line down your body. If you've got pain to the left or to the right of center, a couple inches, we're always going to be looking at other structures in the bladder. So anyway, okay. So I hope, let us know what they say. Let us know what your doctor what the physical therapist finds. I think it's going to be absolutely fascinating what they find. And it'd be really fun to connect you with Sue on Facebook. And you guys might compare some of your horseback riding stuff. I had another girl on our website, Luca, who also was a very, very big horseback rider who had symptoms. And unfortunately, she died in a car accident. But she had it had nothing to do with her IC. It was just a tragic coincidence. But we need to tell more stories about that because the pelvic floor is real,
Right.
All right. Nice talking with you. I'm going to mute you now. All right, Donna, my friend. Can you hear me, Donna? Donna, hold on. Oh, what's my problem? Okay. Can you unmute yourself? I can't hear you. I cannot unmute. No. Okay, hold on. It says you're unmuted on my end. And I know I could hear somebody else, so it's not my headphones. Testing 1, 2, 3. Do testing 1, 2, 3. Do you have a headset plugged into your iPhone? There's there's always there's always something going on. Here, there's somebody on an iPhone I just let in. Tell you what, I'm gonna unmute
Can you hear me?
Yes, yes. What'd you
Can you hear
do?
me?
Yes, I can. All right, hon, how are you doing today? How is your IC?
Can you hear me now?
Yes. Yes, yes, yes.
I'm not doing too bad. You know what? It's so funny because I was thinking about you and I wanted to let everyone know. I wanted to let everyone know how wonderful you've been throughout everything. And you're just the sweetest, wonderful sister anyone could have.
Oh, thank you. Thank you, thank you. I mean, when you have been brought to your knees by pain, when you have begged for help in the middle of the night,
Yes.
all the other stuff goes away. Your
Yes.
everything changes.
Yes,
And
it
the
does, baby.
and the things that you thought were important, whether it is your car or this or that, is meaningless when you begged God to help you, or or
Absolutely,
worse.
baby.
And
Absolutely.
the utter joy and gift of meeting other people who can relate. We understand each other at a visceral level. When I look into your eyes or anybody's eyes and I see your pain and I see your frustration, we are spirit sisters and spirit brothers all the way around. And this
Yes.
this is why this community can survive. It's because
Absolutely, Jill.
we rule with our hearts. And we believe that suffering is evil, and we want to, I. Well, anyway, listen. We don't need to make this any weirder than that. It's just that, at least I think for our generation, because I think Donna, I don't remember how old you are. In my generation, um, a lot of promises were made that were broken. And a lot of words were said that were never followed through on. A lot of and yet we were see, I'm not saying this well, and I apologize for not saying this well.
Yep.
To me right now, this is the fight for my life. This is the fight for our country. This is
It
the
is.
fight for everyone. This is the fight for health rights. This is the fight to end suffering. And that's what I want IC Awareness Month to do, and that's what I want to show on every single day. It's just,
Absolutely, Jill.
you know, it is. So how are you feeling otherwise? How's your IC?
I'm doing pretty good. I really, really am. I was having a flare, during the, I know, sweetheart. I know. And but during the time that Dad, I didn't real, but when things were
Yes.
going on with Dad, it was a little tough for me.
Yeah.
But I got a handle on it, and I'm so glad that I was able to do that.
Yes.
And it was through some of the things that you were talking about with
Yeah.
IC and how to breathe, how to focus, how to really get into yourself and understand your IC and the type of IC that you have, and then connect with that IC and do what you need to do to get through it. And that's what I did. And I am so grateful for that, because it really, guys, it really makes a difference. Lisa, so wonderful to see you. Allison, I don't know you very well, but that's okay. You're part of the community. Faith, Brittany, Nikki, so glad to see you, but all of you, and you make everything that I go through wonderful. Brittany, you too. I'm so glad, and I hope that you feel better too. Listening to Jill is a big deal. She doesn't know everything, I know that, but you know what? She knows a hell of a lot. And I'm telling you right now, getting with IC Network, I'm not promoting, she didn't tell me to do any of this, but I'm telling you, the education with IC Network, the magazines, the chats that we go through, it really, really helps, guys. really does. And I am so glad to see you. And please understand, it makes a difference. She's here for a reason because she's helped me so much. And
Thank you,
God
Donna.
bless all of you. And I won't take it up any more of your time. I want to listen to you. And Jill, thank you so much for allowing me just to do this and allowing all of us to do what we do. And God bless you, Jill. Thank you so much.
Right back at you. I mean, you know, like I lived a very superficial life before this in my 20s. I mean, it was about clothes and and even though I was having some health issues, I didn't, you know, I didn't have a reality check. I mean, when you're young, you cling to things, right? You buy lots of clothes, you buy what and I never did. I mean, I still live a very humble life, but none of it was important. And I think about all the money I wasted,
Yes.
I worked for the feds. I bought suits, Evan Picone suits to wear to work. Really expensive suits at that time. What I was so pompous anyway. So the cool thing is that I see, and just going through this process brings out your humanity, and that's just so important. It's so
Yes, it is.
incredibly
It is.
important, and we are stronger together. And as long as I just don't want anybody to suffer in silence. I want people to know that they're not alone. And weird going on. That's the other thing, is that because I have access to these top doctors,
Mhm.
I send them, and I don't abuse them. I try to protect them, but I send them unusual cases all the time. It's like, okay, have you ever seen this? Have you ever seen that? I just sent them one of a patient who had a really weird reaction to some medicine. And so, if I don't have a guess, I'll certainly ask around to see if I can find a guess.
Yeah.
So thank you. All right, I'm going to go ahead and mute you, and let's see here. Let's see. Hold on. All right. All righty. Okay, so some of you I can see, some of you I cannot see. Faith. Faith wearing a shirt. I'm trying to unmute you here. If it will let me unmute you, it will not. Faith, are you mute? There you go. Hey, how are you doing today? How is life treating you? How's your IC?
It's getting better. I have to tell you, I had a colonoscopy 2 weeks ago, and it flared me up really, really bad. To the point I had to take pain medicine, Norco, or I guess it's Norco now. Used to be Lortab.
So did the prep flare you, or did the procedure flare you?
No, the procedure did. And I've had 3 abdominal surgeries, 2 C-sections, and gallbladder, and I think I have a lot of adhesions, probably.
Okay.
So I'm guessing, that's just my guess, that it might be that, the manipulation.
Had you ever had a colonoscopy before?
First
It
one.
was your first one. So my sister also had, she had 2 C-sections, and she has a wicked adhesion on the left side of her C-section, to the point that she also has this one spot that is really, really bad, to the point that, having any procedure down there is really quite terrible. But you're living proof that you can get through it. So, and hopefully the test went well and they didn't find anything unusual.
Nothing.
Okay.
So I was happy about that.
Okay, so you're free for 5 years, or no, 10 years? How? See, I should be having one next year.
Well, I put it off. I was supposed to have it 10 years ago, and I didn't do it.
Well, I had mine at 50. I actually I have a hysterical story about that, because my sister and I, we work together on the IC network, and her winery. We were very close when we worked together. And I always look for things that we can do together, which is hard when when she's got a big family and I don't, but I have other limitations and stuff like that. So I just called her one day and I go, "Hey, Jen, you want to do something?" And she's like, "Yeah, sure. What do you want to do?" I'm like, "Let's get a colonoscopy together." She was like, it was the first time.
I did the Cologuard first, and it came back positive.
Oh, so that was the
That's why I
right thing
said
to
I
do.
had, I needed to do it.
All right. Good, good, good.
Yeah.
Well, so the good news now is you're over your flare.
Mhm.
And
Mostly.
how's your IC? How's your IC doing?
It's gotten gradually better.
Okay.
I'm seldom without being totally, aware of it.
Okay.
I'm always aware of my bladder most of the time. I've started taking the bladder builder, but I've had to cut back on the dose because it makes me feel like got urinary retention. The full dose.
Okay.
I cut it back in half.
Okay.
And, it's working for me, but not completely.
Okay. Okay.
I'm on my second month of it. And
so how long have you had IC anyway? Is this fairly new or has this been going on for decades?
10 years.
10 years. And how old are you now again?
I'm 66.
Okay, so it started at 56. So it started at exactly around the time we would expect that to start with estrogen atrophy. Hello, Roxanne from Australia. Here, Roxanne from Australia just logged in on Facebook. Roxanne, we're actually doing a Zoom meeting, and you're welcome to join us on the Zoom meeting. And let me just post your, there's your invitation. And hold on, let me scroll back up for the password. 5808. There you go. Oh, you guys are watching this passively on Facebook. I cannot switch to screen share, unfortunately. I can only do that in Zoom. Okay, so getting back to Faith. So Faith, your symptoms started in your middle 50s, right around the time we would expect them to start for patients who are struggling with estrogen atrophy, genitourinary syndrome of menopause, right?
How it came up was I thought I had a UTI.
Okay.
Went to the doctor and it wasn't, and treated with antibiotics didn't help. Let me think. I had been on hormone replacement for 10 years, and the doctor decided it was time to stop. And so I went off, or they put me on, I was on the patch, they put me on the pill to wean me off, and slowly cut it down. And I went off of it pretty quickly, though, within a month. And that's when it started, as soon as I stopped the hormones. I don't know. I'm thinking it has some relation to that. But.
Well, yeah, because you basically, I mean, you did the chemical equivalent of having a hysterectomy. You just stopped your estrogen, and progesterone if you're doing the progesterone too. But the estrogen is what your body needs to produce mucus. And so when you lose the estrogen, your mucosal barrier gets thinner and thinner and thinner. Your bladder's ability to protect itself is diminished with aging. It's not a disease process. That is not a disease. That is just estrogen atrophy. And so, and your job now is, yeah, it's just about trying to protect your bladder wall. The therapy would be a topical estrogen and a bladder coating like Elmeron or a chondroitin-based supplement. And it's there are some people that have no problems with estrogen atrophy, and then others get I'm a super sensitive one. And if I don't use my estrogen cream, my urethra is not happy. Your urethra is kind of like your canary on your in the coal mine of estrogen atrophy. So it's like the first part that really starts to get sensitive. And if you feel like you have a drop of urine stuck in your urethra that won't come out, then that is like classic estrogen atrophy in the urethra. Okay. So the cool thing is you're doing the right thing. You're trying a chondroitin-based supplement. You can give the bladder builder a little bit more time. If that doesn't work, you can try one of the others. Yeah. But I'm glad
It's definitely helped. It's definitely helped. I would say more than 50%.
Good.
Yeah, so
Good.
I can tell the difference.
Good. Excellent. Well, let's just keep it up and we get to grow old gracefully together. So you guys, my 60th birthday is on July 12th. I don't even know what day of the week that is. What day of the week is that? That'd be so cool if it was a Sunday. Oh my God, it is. Okay, we're gonna have a birthday party on July 12th because nobody's coming over. We're gonna do an online birthday party for everybody with IC who's had birthdays and missed them. Okay. Hello world, we're 60. Okay, hon, I'm gonna mute you and I'm gonna move on. But thank you for sharing your story. Okay, I'm gonna go to somebody that I cannot see. And you guys, I'm just jumping around. Please don't take it personally. I'm just randomly picking people. Kelsey, are you there? Kelsey? She might just be watching. Kelsey? Okay. We're going to mute her again. Mickey, right above her on my screen. I can't even tell if you guys see what I see. So, Mickey King, how are you, my dear?
I'm having a heck of a time. Can you hear me?
I can. All right.
Oh, good.
What's
I've
going
been watching you and I finally get to talk to you. I'm so happy.
Awesome.
Well, I've had this for probably 40 years.
Mm-hmm.
And it's been a heck of a ride. But I just real quick, what I'm going through is I was in the hospital with pneumonia about 2 months ago. They told me it was COVID, but then after 5 tests, they said it wasn't. And they pumped all, I was getting 3 bags of antibiotics in my arm each day. In each arm, 3 bags. Anyway, so I get out and now because I'm 62, I haven't had a menstrual cycle since I was 50. And I feel like I'm having hot flashes and I feel like I'm going to start my period. And it's the weird, and my urologist doesn't know what to do with me. My doctor doesn't know what's going on. Real odd.
So you haven't had a period since you were 50.
Right.
Do you have any spotting or bleeding or anything at all going on?
But it feels like it. because that's what my doctor said. And I've been looking, but the hot flashes were really bad. I'm just thinking maybe it was the stuff that I was kicking out, but I've been in a horrible flare ever since then. And one other thing, I have been through everything. So we're at the point where he wants to do the interstim.
What?
And
okay. So number one, you were on massive antibiotics. And this began after or while you were in the hospital okay. So concept number one, is this a fungal infection? Whenever you take antibiotics, you're killing the good bacteria that keep the bad bacteria in check, right? And the bad fungus in check. You are textbook at risk for a Candida infection, a Candida infection, which means acquired in a healthcare setting, acquired in the hospital. And drug-resistant Candida infections are very common in hospitals. And
they would give me a painful shot in my stomach too. I don't know what it was, but
before doing surgery like Interstim, I would certainly want to rule out some of the basic stuff that we know happens for patients who are hospitalized. And it would be absolutely fascinating. Oh, I've got people waiting to come in. Hold on a sec.
Oh, okay.
Sorry.
I don't want to take up your time.
No, hon. You're important. Oh, wait a second. We might be being invaded. We are. Hold on. Give me a second, guys. Listen, there are 3 gentlemen in the room. I mean, waiting. Yeah. You're going out. All right. Whoops. Hold on. Wait, I didn't do that. No, 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 no. No. Okay, hold on.
Mhm.
Okay. Crap. Okay, so there are at least 3 guys in the waiting room, and I'm not sure who is on this iPhone. And if y'all want to come into the room, okay. All right, you're leaving, so I'm just going to remove you. Sorry, guys. The last thing we need is for them to turn on their phone and give us a picture of their, you know what, right? You know. Lisa says, don't give anybody any ideas. Okay, so there's one person here on an iPhone, and I don't know. I think you're okay. No. Okay, he's gone. All right. Sorry about that, guys. So I had to mute everybody. And Padre Domingo, I'm sorry you're not coming in. That's hysterical. All right. So, guys, this is what we're going to do. Everybody on Facebook, you know I absolutely love and adore you. I am going to shut down Facebook because we now have invaders. So I'm going to let Facebook go. You can email me, icnetwork@mac.com. If you want the invite, I will email it to you. Shelly, you just came in. Shelly, we're in a Zoom meeting now, and I'm going to shut down our Facebook meeting, but you're absolutely welcome to come on over to our Zoom meeting. And I would love to have you in our support group. Please email me, icnetwork@mac.com. That's M as in Mary, A as in Apple, C as in Charlie.com, and I will send you the invite. All right? All right, Facebook, I'll see you. Once we start getting invited, we got to be super careful here. All right, Facebook's gone. YouTube, my friends on YouTube, same thing for you. If you would, I don't know where those invaders came from. If you would like to join this live chat, please come on over. And please email me, icnetwork@mac.com, and I will send you the invite. Okay. So I'm going to say goodbye to YouTube. All right. YouTube is over.